The sun hung low over the mountains of Kandahar province, casting long shadows across forward operating base. Sentinel as Eleanor Hayes walked through the mess hall with steady steps. A steaming mug of black coffee in one hand and decades of medical experience in the other, she moved between tables of young soldiers like a patient guardian watching over her flock. At 62, with silver hair pulled back in a tight bun and wire-rimmed glasses perched on her nose, Eleanor stood out among the uniformed troops who barely glanced her way. Few knew she had once been the most decorated combat nurse in 3 military campaigns. Fewer still understood why she now worked as a civilian medical consultant, relegated to equipment inspections and inventory counts. But in less than 24 hours, when mortar fire would rain down on their position and 12 young soldiers would lie bleeding in the dust, every single person on this base would learn her name. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The morning routine at FOB Sentinel followed the same pattern it had for months. Young medics in crisp uniforms practiced triage drills, checked supplies, and traded stories of hometown glory while Eleanor methodically inspected each medical station. She didn't command attention anymore, her weathered hands moving with quiet precision as she counted bandages, checked expiration dates on medications, and assessed the readiness of equipment that most hoped would never be needed. Her face remained calm, focused, unreadable except for the rare moments when she smiled at the younger staff, which didn't happen often. Officially, Eleanor was a civilian medical logistics coordinator, assigned to this joint American-Afghan outpost along the volatile southern border. Her job was administrative, organizing supplies, training schedules, and equipment maintenance. She wasn't supposed to touch patients anymore. Not since the incident in Iraq 5 years earlier when her unauthorized field surgery had saved a Marine's life, but violated 3 different protocols. Now she walked the hospital tents like she still belonged in them, checking trauma kits and reorganizing medical supplies when no one was looking. Most of the young medics knew her only as Ms. Hayes or the inventory lady. Some had heard whispers that she used to run MASH units back in Desert Storm. Others assumed she was just another retired military nurse filling a civilian contract position. She never corrected them. It was easier that way. The atmosphere that morning was unusually tense. Intelligence reports had warned about increased insurgent activity in the nearby mountains for weeks. Special Forces teams were on high alert. Communication channels were heavily monitored, and reports from patrols spoke of villagers abandoning their homes in the valley. But there had been no major attack yet, just the waiting, the uneasy calm that often preceded violence in this part of the world. Captain Ryan Matthews stood beside a trauma station, laughing with 2 junior medics. He was tall, confident in the way only someone fresh out of medical school with 1 deployment under his belt could be. When he spotted Eleanor approaching, he gave a dismissive nod. "Hayes, we got those antibiotics you requisitioned. Half of them are about to expire next month, though," he said with a smirk. She didn't smile. "And yet you'll be glad we have them when the wounded start coming in." His expression faltered, then returned. "I heard you used to run field hospitals back in the old days." "What was that, Vietnam?" She ignored the bait. "Make sure your rapid infusers are calibrated. The dust gets in everything out here." Matthew's colleagues chuckled as she walked past, clipboard swinging at her side. She made her way to the edge of the medical compound where the older equipment was stored, one particular section cordoned off with a faded yellow tape. Behind it sat emergency surgical kits that no one touched, collecting dust and sand. The equipment logs were outdated, the clearance for field deployment revoked after a budget reassessment, but Eleanor knew every instrument by memory. She ran her fingers along a portable surgical station that bore the worn label Phoenix Unit, the very equipment she had used during the Gulf War to save over 40 soldiers in a single 36-hour stretch without sleep. Back then, she had performed emergency thoracotomies under fire as shells exploded outside her tent. Back then, she had been the doctor other medics called when they thought a case was lost. Back then, she hadn't needed anyone to give her permission to save lives. A loud siren blared across the base. Just another drill. They ran these exercises every week, simulating mass casualty events, triage protocols, evacuation timelines. Eleanor already knew what would happen. The junior medics would scramble to assign treatment stations. A few would pretend to be overwhelmed for the training exercise, and Captain Matthews would demonstrate proper procedure with the confidence of someone who had never had a patient die under his hands. But today felt different. She checked her watch. 9:17 a.m. At exactly that moment, the radio operator from the communications tent burst through the door, face pale with urgency. "Incoming. This is not a drill. Multiple mortar, eastern perimeter." The first explosion hit before anyone could respond, the ground shuddering beneath their boots. Medical supplies tumbled from shelves, equipment carts rolled, and lights flickered across the compound. Eleanor grabbed a support beam and steadied herself as more impacts followed, rising in intensity until the very air seemed to vibrate with concussive force. Casualties reported at Checkpoint Delta. Someone shouted over the chaos. Patrol team caught in the open. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Captain Matthews was already on the radio, his earlier smugness replaced by the strained composure of someone facing their first real crisis. "This is medical, preparing for incoming wounded. How many? What's their status?" 12 confirmed. Multiple trauma types, heavy bleeding. 2 critical, maybe more. The medevac chopper can't land, too much ground fire. Eleanor didn't hesitate. While others scrambled for protective gear, she was already moving toward the equipment storage, pulling out the Phoenix Unit surgical kits that had been deemed obsolete by Pentagon accountants. "What are you doing?" Matthews called after her. "Getting ready to save lives," she replied without looking back. Within minutes, the wounded began arriving, not by helicopter, but by armored vehicle that screeched to a halt outside the medical tent. Soldiers carried their bleeding comrades on stretchers, tarps, even doors removed from hinges. The injuries were catastrophic: shrapnel wounds, traumatic amputations, sucking chest wounds that bubbled with each labored breath. The medical team worked frantically, but they were understaffed and overwhelmed. 2 nurses struggled with a massive hemorrhage, blood soaking through layers of gauze faster than they could apply it. A medic froze, hands trembling above a soldier with exposed intestines. Captain Matthews moved between patients, trying to maintain order, but his voice grew increasingly strained as the situation deteriorated. Eleanor stood at the entrance, watching the chaos unfold. In an instant, decades of training crystallized into absolute clarity. She grabbed surgical gloves, snapped them on, and moved to the most critical patient, a young soldier no more than 20, with a tourniquet on what remained of his right leg and a chest that barely rose with each breath. "Move," she said too. The panicking medic, her voice calm but leaving no room for argument. "Ma'am, you're not authorized," he began. "This boy has tension pneumothorax and is 2 minutes from death. Move or help me." She didn't wait for his response. Her hands, lined with age but steady as stone, reached for a chest decompression needle. With practiced precision, she inserted it between the soldier's ribs, releasing trapped air with a soft hiss. His oxygen levels immediately began to rise. "Push 1 gram of tranexamic acid. Start 2 large bore IVs with whole blood. And get me the portable ultrasound," she commanded, already moving to assess his other injuries. The medic stared at her for a moment, then jumped to action. Across the room, Captain Matthews noticed what was happening. "Hayes, you are not cleared for patient care. Step back immediately." She didn't even look up. I need suction and retractors. This boy has arterial bleeding in the retroperitoneal space. That's an order. Matthews shouted, his face flushed. Eleanor finally looked at him, her eyes calm. Behind her glasses. Then court-martial me when these soldiers are stable. Right now, I'm the only chance they have. A sudden explosion rocked the medical tent, closer than the others. Dust rained from the ceiling. In the momentary silence that followed, a wounded soldier cried out in pain. Captain Matthews stood frozen, the weight of 12 lives pressing against his limited experience. Eleanor turned back to her patient. The bleeding's getting worse. I need to open him up right here. For 3 seconds, no one moved. Then a senior medic grabbed a surgical tray and placed it beside her. What do you need, ma'am? Everything in the Phoenix unit, and someone who isn't afraid of blood. What happened next would later be described by witnesses as a masterclass in battlefield medicine. Eleanor Hayes moved from patient to patient with unnatural calm, her hands performing procedures most of the younger staff had only read about in textbooks. She converted a tension pneumothorax to an open pneumothorax to save a collapsing lung. She performed a partial fasciotomy using equipment meant for field dentistry. She diagnosed internal bleeding patterns by touch alone when the ultrasound failed. The artillery continued outside, each impact a reminder that evacuation remained impossible. They were on their own, and the wounded kept arriving. A young Afghan interpreter with shrapnel in his neck. A female soldier with a compound femur fracture. A communication specialist whose burns covered 30% of his body. Through it all, Eleanor never raised her voice, never showed fear. She worked methodically, delegating tasks to those who could handle them, guiding those who couldn't. Even Captain Matthews found himself following her lead, his earlier hostility replaced by stunned respect as she talked him through a vascular repair he'd never attempted before. "Steady hands, Captain," she said quietly. "This artery feeds his brain. Think of it as threading a needle, not saving a life." 4 hours into the crisis, the artillery finally stopped. The wounded had been stabilized, all 12 still breathing, still fighting, but evacuation remained impossible until nightfall. Eleanor stood at the far end of the medical tent, washing blood from her hands in a basin of disinfectant. Her scrubs were soaked through, her silver hair had fallen from its bun, and exhaustion lined her face. But her eyes remained clear, focused. Captain Matthews approached slowly, his own uniform splattered with the evidence of their shared battle. "How did you know?" he asked, his voice barely audible. About Rodriguez's abdominal bleeding, there were no external signs. "The pattern of bruising on his flank," she replied simply. "I've seen it before." He nodded, then hesitated. "What you did today, those procedures, some of them aren't even in our field manuals." "That's because field manuals are written by committees, not combat surgeons." She dried her hands on a towel. "Some things you only learn by doing." As night fell over Fobb's Sentinel, the medevac helicopters finally arrived, rotors cutting through the darkness with promises of proper hospitals and advanced care. The medical team worked silently, loading their patients with gentle efficiency, every movement tinged with the intimate bond that forms only in shared crisis. Eleanor supervised each transfer, whispering encouragement to semi-conscious soldiers, giving detailed handoffs to the flight medics. Only when the last helicopter lifted off, its red lights blinking against the star-filled Afghan sky, did she allow herself to sit down, her body suddenly heavy with the weight of what she had accomplished. The medical tent, hours earlier a scene of desperate struggle, now stood empty except for the evidence of their fight: discarded packaging, bloodied gauze, cut clothing. And in the center, Captain Matthews sat on an overturned supply crate, staring at his hands as if seeing them for the first time. 12, he said finally. All 12 still alive. Eleanor nodded, too tired for words. "They told me you were just a consultant," he continued. Just an old nurse who couldn't let go of the past. He looked up at her. They never said you were Eleanor Hayes. She raised an eyebrow. I read about you in medical school, he explained. The Angel of Fallujah. The woman who performed 17 successful field amputations during a sandstorm when supplies ran out. I thought you were a legend, not a real person. Eleanor's lips curved into a small smile. Most legends start with someone just doing their job, Captain. As dawn broke over the mountains, word of what had happened in the medical tent spread across Fob Sentinel. Soldiers who had never noticed the quiet older woman with the clipboard now stopped to stare as she made her rounds, checking on the few remaining wounded who hadn't been evacuated. Some whispered as she passed, others stood straighter, a few even saluted though she wore no uniform. By mid-morning, the base commander himself arrived at the medical compound, accompanied by 2 officers Eleanor didn't recognize. She was inventorying what remained of their supplies when he approached. Ms. Hayes, he said formally. I understand we owe you a debt of gratitude. She didn't look up from her clipboard. You owe me nothing, Commander. I was just doing what needed to be done. That's not how the flight surgeons at Bagram see it. They say your field intervention saved at least 5 who would have died in transit. He paused. They also mentioned that several of your procedures violated standard protocol. Now she looked up, her expression unchanged. Medicine isn't about protocols, Commander. It's about patience. He nodded slowly, then gestured to one of the officers beside him. This is Colonel Richardson from Medical Command. He'd like to speak with you. The colonel stepped forward, his face unreadable. Ms. Hayes, I've reviewed the preliminary reports from last night's incident. Your actions were unconventional. Unconventional saves lives when conventional isn't an option. Nevertheless, there are procedures, regulations. I'm well aware of the regulations, Colonel, she interrupted. I helped write some of them. But regulations assume conditions that didn't exist here yesterday. The base commander cleared his throat. What Colonel Richardson is trying to say, Ms. Hayes, is that your contract explicitly prohibited direct patient care. Eleanor set down her clipboard. Are you here to reprimand me for saving 12 of your soldiers? A tense silence followed, broken only when the 3rd officer, an older man with the insignia of a general, stepped forward. Actually, Ms. Hayes, we're here to offer you a position. His voice was deep, measured. I'm General Wilson, Central Command Medical Operations. I was in Baghdad when you ran the trauma unit during the Second Gulf War. Your work there rewrote our understanding of battlefield medicine. Eleanor studied him cautiously. I'm not interested in Pentagon consulting roles, General. I've filled out enough reports to last several lifetimes. He smiled slightly. This isn't about paperwork. We're establishing a new combat medical training initiative. Teams of experienced surgeons and nurses deployed to high-risk forward positions, training medics in real-world conditions. He paused. We need someone who knows the difference between textbook medicine and battlefield reality. You have plenty of young doctors for that. Young doctors who freeze when the artillery starts, Captain Matthews interjected, appearing from the entrance of the tent. Young doctors who need someone like you to show them how it's really done. Eleanor looked between them, suspicious. The last time I suggested changes to the training protocols, I was told I was out of touch with modern methods. General Wilson nodded grimly. And then we lost 38 soldiers in the Koringal Valley because those modern methods failed. Under pressure, he extended a folder toward her. This isn't charity, Eleanor. This is necessity. Our medics respect rank, but they follow people who've proven themselves under fire. She took the folder but didn't open it. And my unconventional methods will be documented, analyzed, and incorporated where effective. The general's expression softened slightly. The rules aren't changing, but maybe our understanding of when to bend them needs to. As the officers left, Eleanor remained still, folder in hand, contemplating a future she hadn't imagined possible. Captain Matthews lingered, his earlier arrogance replaced by something resembling humility. "For what it's worth," he said quietly, "I've never seen anything like what you did yesterday." "You will," she replied. "War doesn't change, Captain. Only the people fighting it do." Later that evening, as the base settled into uneasy calm, Eleanor sat alone in her quarters, reading through the proposal. The position offered everything she'd been fighting for since her demotion to consultant, direct involvement in patient care, authority to implement training changes, respect for her experience rather than her age. A knock at her door interrupted her thoughts. It was a young soldier, one she recognized from the motor pool. "Ma'am, I'm sorry to bother you, but I wanted to thank you. My brother was one of the 12 yesterday. The one with the chest wound." His voice wavered slightly. "The doctor at Bagram said if you hadn't done what you did, he wouldn't have made it to surgery." Eleanor nodded, uncomfortable with gratitude. "What's his name?" Michael Hernandez." "He fought hard," she said simply. "That counts for more than anything I did." After the soldier left, Eleanor returned to the proposal, pen in hand to sign the acceptance form. But something stopped her, not doubt about the position, but awareness of what accepting it would mean. A return to legitimacy, yes, but also a return to the system that had discarded her experience when it became inconvenient. Instead of signing, she pulled out a blank sheet of paper and began writing her own proposal, not for a training initiative, but for a complete overhaul of field medical protocols. She wrote through the night, filling page after page with lessons learned through decades of saving lives when others had given up. Dawn was breaking when she finished. She placed her counter-proposal in the folder, sealing it with a note that read, "I'll accept on one condition, that we stop teaching medics how to follow protocols and start teaching them how to save lives." 3 days later, as Eleanor supervised the reorganization of the medical compound, word came that her terms had been accepted. Not just accepted, championed by General Wilson himself, who had apparently presented her counter-proposal directly. To the Surgeon General of the Army, the news spread quickly across Phobe Sentinel. Soldiers who had once ignored her now stopped to listen when she spoke. Junior medics who had rolled their eyes at her suggestions now took notes. Even Captain Matthews approached her with a newfound respect, requesting permission to assist with her new training program. "I want to learn," he said simply. "Not just the procedures, but how you think. How you stay calm when everything is falling apart." She considered him for a moment. "That part can't be taught, Captain, but I'll show you everything else." As the weeks passed, Eleanor's program transformed not just for Phobe Sentinel, but bases across Afghanistan. Her methods, once dismissed as outdated or unconventional, became the standard against which all field medical units were measured. Young medics traveled hundreds of miles for the chance to train under the professor, as she had come to be known. Officers who had once questioned her authority now cited her techniques in their reports. Yet Eleanor herself remained unchanged, still the first to arrive at the medical compound each morning, still meticulously checking supplies and equipment, still speaking only when necessary. The legends that grew around her name meant nothing. To her, what mattered were the lives saved, the medics trained, the lessons passed on. One evening, as she finished documenting a particularly challenging training session, Captain Matthews brought her a cup of coffee and sat down across from her. "I heard from Bagram today," he said. "All 12 made it. Even Hernandez with his pulmonary laceration. They're all going home." Eleanor nodded, allowing herself a small smile. "You know," Matthews continued, "before all this, I thought experience was just a polite word for outdated. I thought newer was always better." He stared into his coffee. "I was wrong. Most of us are at some point," she replied. "The difference is whether we learn from it." As darkness fell over the mountains of Kandahar, Eleanor Hayes stood at the edge of the medical compound, watching as a new group of medics practiced the techniques she had refined through decades of war and sacrifice. They moved with growing confidence, their hands steady, their minds focused not on protocols, but on the principles that underpinned them. In the distance, artillery flashed against the night sky, a reminder that their skills would soon be tested. Again in the crucible of combat, but Eleanor wasn't worried. She had done more than teach them procedures. She had shown them how to think when thinking seemed impossible, how to save lives when saving seemed beyond reach. A young medic approached, hesitant but determined. "Ma'am? We were wondering, would you tell us about Fallujah? About what really happened there?" Eleanor considered the request, then nodded slowly. As they gathered around her, these young men and women who would carry her legacy forward, she began to speak, not of glory or heroism, but of the quiet, relentless commitment to preserving life in the midst of destruction. And as she spoke, something shifted in the air around them, a passing of wisdom from one generation to the next, a thread of human compassion connecting past to future across the blood-soaked fields of war. The next morning, as the sun rose over FOB Sentinel, Eleanor Hayes walked through the medical compound with her customary cup of coffee and clipboard. But something had changed. The glances that followed her were no longer dismissive or curious. They were reverent. The space that formed around her was no longer the isolation of the outsider, but the respect accorded to a teacher. As she passed the trauma station where, weeks earlier, Captain Matthews had mocked her age and experience, she noticed something new. A small plaque had been mounted beside the equipment locker. It read simply, "Hayes Doctrine, save the life first. Ask permission later." She paused, ran her fingers over the engraved words, then continued on her rounds, her path no longer that of a ghost haunting the edges of relevance, but of a legend, walking among those fortunate enough to learn from her. The woman who had once been laughed off the base had become its heart, its conscience, its guiding hand. And somewhere in the mountains, as the war raged on, 12 soldiers continued their journey home, living testaments to the truth that sometimes the ones we overlook are the very ones who carry us when we fall. 2 months into Eleanor Hayes' Combat Medical Training Initiative, FOB Sentinel had transformed from an ordinary forward base into what many now called Hayes Academy. The medical compound, once a collection of dusty tents and outdated equipment, now hummed with purpose and precision. Under Eleanor's guidance, what began as a desperate improvisation during a mortar attack had evolved into a systematic approach to battlefield medicine that prioritized adaptability over rigid protocol. The Pentagon had sent observers, other bases had requested training manuals, and 3 times a week, transport helicopters arrived carrying medics from across Afghanistan, all eager to learn from the silver-haired woman who had saved 12 soldiers when everyone else had given up. But fame hadn't changed Eleanor. She still woke before dawn, still carried her clipboard through morning rounds, still inspected every medical station with the same methodical attention she had shown when no one knew her name. The only difference was that now, when she spoke, people listened. On this particular morning, as the first hints of sunlight painted the mountains in shades of amber and gold, Eleanor stood watching a group of medics run through a mass casualty drill. They moved with growing confidence, their actions crisp but not mechanical, exactly as she had taught them. "You've created something remarkable here," said a voice behind her. Eleanor turned to find General Wilson, his uniform immaculate despite the dust that seemed to coat everything at FOB Sentinel. He had returned for his monthly assessment of the program, though everyone knew these visits were more formality than oversight. "They created it," Eleanor replied, nodding toward the medics. "I just showed them where to look." The general smiled slightly, always deflecting credit. Some things never change. He paused, watching the drill continue. "I've been authorized to expand your program. 3 more bases initially, potentially theater-wide by year's end. Eleanor raised an eyebrow. Expansion means bureaucracy. Bureaucracy means compromise. Not this time. He handed her a folder. Full autonomy. Your methods, your standards, your instructors. The Joint Chiefs have seen the data, 93% survival rate for critical wounds treated under your protocols, compared to 67% under standard field procedures. She took the folder but didn't open it. Numbers don't tell the whole story. No, Wilson agreed, but saved lives do. And right now, your methods are saving more of them than anyone else's. Before Eleanor could respond, alarms blared across. The base, not the practice sirens used for drills, but the high-pitched wail that signaled immediate threat. Soldiers ran for defensive positions, radios crackled with urgent commands, and the distant thump of mortar fire echoed against the mountains. Incoming! Someone shouted. Multiple hostiles approaching from the North Ridge. General Wilson was already moving toward the command center, but Eleanor remained still, watching as her medical trainees immediately shifted from drill to reality. Without panic, without hesitation, they secured equipment, prepared trauma stations, and established triage positions, exactly as she had taught them. Captain Matthews appeared at her side, his face set with determination rather than fear. Ma'am, intel says it's a coordinated attack. Possibly Taliban, possibly local militia, at least 30 fighters. Casualties? She asked, already moving toward the main medical tent. None reported yet, but they're targeting the northern checkpoint. We should be ready for. The explosion cut him off, a massive blast that shook the ground beneath their feet. Dust billowed from the direction of the perimeter fence, followed by the rapid staccato of gunfire. Get the Phoenix units ready, Eleanor ordered, her voice calm despite the chaos erupting around them. And tell the surgical team to prepare for vascular trauma. Those northern positions have minimal cover. For the next 20 minutes, FOB Sentinel descended into the controlled chaos of combat. Mortar landed with increasing accuracy machine. Gunfire raked the defensive positions, and the radio channels filled with the tense communications of soldiers under attack. Through it all, Eleanor's medical team worked with quiet efficiency, preparing for the wounded they knew would soon arrive. The first casualties came in waves. 3 soldiers with shrapnel wounds, a Marine with a bullet through his shoulder, 2 Afghan interpreters suffering from blast concussion. Eleanor moved between them, assessing, directing, occasionally intervening when a procedure required her experienced hands. Then came the critical cases, a young lieutenant with a severed femoral artery, a staff sergeant with blast injuries. To his abdomen, a radio operator with a penetrating head wound that left brain matter visible through shattered skull fragments. These were the cases that would have overwhelmed the medical team before. Eleanor's training, the ones that required intuition as much as knowledge, courage as much as skill. Matthews, take the arterial bleed, Eleanor directed, already moving. Toward the head trauma victim. Remember the compression sequence we practiced. Singh, you've got the abdominal trauma. Start with focused assessment, then we'll reassess for surgical intervention. Her voice remained level, her movements unhurried despite the urgency of each case. Around her, the medical team responded with the same controlled precision, every action purposeful, every decision informed by the principles she had instilled. In them, treat the deadliest injury first, conserve resources without compromising care, adapt when protocols fail. In the midst of the chaos, a young medic rushed in, her uniform covered in dust and blood. Ms. Hayes. Northern bunker took a direct hit, 5 wounded, 2 trapped. They can't reach them while under fire, and the injured can't be moved without medical support. Eleanor looked up from the head trauma patient, now stabilized for emergency neurosurgery. Around her, the medical tent was filled to capacity, every bed occupied, every medic engaged. Going to the northern bunker meant leaving the relative safety of the compound entering an active firefight with minimal protection. Captain Matthews looked at her, understanding dawning in his eyes. You can't go out there. It's too exposed. Those men will die without immediate intervention, Eleanor said simply, already reaching for a field kit. Then I'll go, Matthews offered, stepping forward. Eleanor assessed him with a single glance. Capable, yes, but not for this. You're needed here. The arterial repair requires your hands. She turned to the young medic who had brought the news. What's your name? Cooper, ma'am, Sarah Cooper. Combat medical training? Yes, ma'am. 16 weeks, plus your advanced course last month. Eleanor nodded. You're with me. Bring 2 units of blood, the compact surgical kit, and all the hemostatic gauze you can carry. Before anyone could protest further, Eleanor was moving toward the door, her stride purposeful. General Wilson, who had returned to the medical compound to check on the casualties, watched in disbelief. Hayes, you're the head of this program. You can't risk yourself in a combat zone. She didn't slow down. That's exactly why I have to go, General. I don't teach from textbooks. Outside, the attack continued unabated. Bullets whined overhead. Mortar exploded in the distance, and the air filled with the acrid smell of gunpowder and burning equipment. Eleanor and Cooper moved in a crouched run, following a young sergeant who led them toward the northern perimeter where the bunker had been hit. Direct mortar strike, the sergeant explained as they ran, collapsed the eastern wall. 2 men pinned under concrete, 3 others with blast injuries. Enemy has sight lines to the main entrance. That's why we can't extract them. Is there another way in? Eleanor asked, not breaking stride despite her age. Drainage culvert on the western side. Tight fit but passable. They reached the perimeter fence, taking cover behind a row of concrete barriers as bullets pinged off the metal supports nearby. From here, Eleanor could see the damaged bunker. What had once been a reinforced observation post was now a partially collapsed shell, smoke rising from its eastern side. Cover us to the drainage access, she instructed the sergeant. Then hold position. If we're not out in 20 minutes, we're not coming out. The sergeant nodded grimly, then raised his rifle and fired a series of covering shots. Go now. Eleanor and Cooper sprinted across 30 meters of exposed ground, bullets kicking up dust at their feet. They reached the western side of the bunker where a narrow drainage pipe, barely wide enough for an adult, offered the only protected entrance. I'll go first, Eleanor said, already removing her medical backpack and pushing it into the culvert. Pass the supplies through after me. Ma'am, Cooper hesitated, with respect. You might not fit. Let me. I've crawled through worse. In 3 wars, Cooper. The supplies need to arrive intact, which means I cushion them, not you. Without waiting for further discussion, Eleanor lowered herself into the drainage pipe, her slim frame barely fitting through the narrow opening. The culvert was dark, choked with dust and debris, but Eleanor moved with determination, pulling herself forward on elbows and knees. Behind her, Cooper pushed the medical supplies through, then followed, her younger body navigating the tight space more easily. They emerged into the shattered interior of the bunker, where the scene matched the worst of Eleanor's wartime experiences. The mortar had blown through the eastern wall, collapsing part of the ceiling. 2 soldiers lay pinned beneath chunks of concrete and twisted metal, both conscious but trapped. 3 others had been thrown by the blast, 1 unconscious with head trauma, 1 clutching a mangled arm, 1 sitting against the wall pressing a blood-soaked cloth to his neck. Eleanor assessed the situation in seconds. Cooper, start with the neck wound, direct pressure, then hemostatic gauze. I'll check the trapped men first. She moved to the nearest pinned soldier, a young man barely in his 20s, his lower body obscured by a massive concrete slab. His face was gray with dust and pain, but his eyes focused on her immediately. Are you really here? He asked, his voice weak with shock. "I'm really here," Eleanor assured him, already checking his pulse and pupils. "What's your name, soldier?" "Davis, ma'am. James Davis." "Well, Davis, I need you to stay very still while I see what we're dealing with." She carefully examined the position of the concrete slab, assessing whether it could be moved without causing catastrophic bleeding. "Can you feel your legs?" "Left one, yes." "Hurts like hell. Right one, nothing." Eleanor nodded, keeping her expression neutral despite the implications. She moved to the second trapped soldier, whose situation was even more dire. A metal support beam had impaled his shoulder, pinning him to the ground while also stanching what would otherwise be a fatal hemorrhage. "Daniels," he gasped when she asked his name. "They said no one could get in." "They were wrong," Eleanor replied simply, opening her medical kit. "I'm going to give you something for the pain, then we're going to get you both out of here." For the next 15 minutes, Eleanor and Cooper worked with methodical urgency, stabilizing the most life-threatening injuries while calculating how to free the trapped men. The bunker continued to shake with nearby impacts, dust raining down with each explosion, but neither medic showed any sign of fear. "Cooper, prepare a pressure bandage with hemostatic agent," Eleanor instructed as she examined the metal beam, impaling Daniels. "When I extract this, he'll hemorrhage immediately. We'll have about 30 seconds to control the bleeding." Cooper's hands moved with practiced efficiency, preparing the specialized bandage. "Ready, ma'am." Eleanor met Daniel's terrified gaze. "This will hurt, but then we can move you." "Ready?" He nodded once, jaw clenched. With a surgeon's precision, Eleanor grasped the metal beam and pulled it free in one smooth motion. Blood immediately spurted from the wound, bright arterial red against the gray dust. Cooper applied the pressure bandage exactly as trained, while Eleanor already moved to secure the damaged blood vessels with specialized clamps from her kit. "Pressure holding," Cooper reported, her voice steady despite the chaos around them. "Good, now for Davis." Eleanor turned to the young soldier trapped under concrete. "We can't move this slab without equipment, but we can stabilize you until help arrives." As she worked, administering pain medication and treating Davis's accessible injuries, another mortar struck nearby, closer than the others. The bunker shuddered violently, and more of the ceiling began to give way. "We need to move now," Eleanor said, urgency finally entering her voice. "This structure won't hold much longer." Together, they prepared the wounded for transport, the neck wound stabilized, the head trauma immobilized, the mangled arm splinted. Daniels could be moved now that his shoulder wound was controlled, but Davis remained trapped, the concrete slab impossible to shift without mechanical assistance. "Go," Davis said, understanding their dilemma. "Get them out." Eleanor knelt beside him. "I don't leave people behind." "You have to," he insisted. "Save them. Send help when you can." Another impact rocked the bunker, and a large crack spread across the remaining ceiling. They were out of time. Eleanor made her decision. "Cooper, start moving the wounded through the culvert." "I'm staying with Davis." "Ma'am, that's an order, medic. Move these men out while you still can." Cooper hesitated only briefly before nodding. With remarkable strength for her size, she began helping the mobile wounded toward the drainage culvert, guiding them to safety one by one. Alone with Davis, Eleanor continued treating his accessible injuries, administering fluids and monitoring his vital signs. "Help will come," she assured him. "But until then, you've got me." "They said you were a legend," Davis murmured, the pain medication beginning to take effect. "The old nurse who saved 12 men during the mortar attack. I didn't believe it." Eleanor smiled slightly. "Always question legends, Davis. They're usually just people doing what needs to be done." Outside, the sound of gunfire had changed, more intense, but more distant, suggesting the attackers were being pushed back. Through the damaged wall, Eleanor could see American helicopters approaching, their silhouettes dark against the morning sky. "Reinforcements," she told Davis. "Not long now." The next 10 minutes stretched like hours as the bunker continued to deteriorate around them. Twice more, Eleanor had to reinforce Davis's the fourth line when falling debris threatened to dislodge it. Once, she covered his body with her own as a section of wall collapsed nearby. Throughout it all, she kept talking to him, keeping him conscious, keeping him fighting. Finally, the sound of rescue reached them, voices calling from outside. The mechanical whine of equipment being positioned. "In here," Eleanor shouted. "One man still trapped, needs immediate extraction." The eastern wall, already partially collapsed, was breached by rescue personnel in full combat gear. They poured into the bunker, expressions changing from urgent to astonished when they saw Eleanor kneeling beside Davis, calmly monitoring his vital signs amid the rubble. "Ma'am," one of them said, recognition dawning, "you're currently treating a patient with potential crush injuries and a compromised right leg," she interrupted. "He needs immediate extraction and vascular assessment." The team moved into action, bringing specialized equipment to lift the concrete slab while Eleanor prepared Davis for the critical moment when pressure would be released from his trapped limbs. "Crush syndrome protocol," she instructed the medic, who had joined her. "Have calcium gluconate ready, watch for hyperkalemia, and prepare for fasciotomy if compartment pressure exceeds 30 millimeters." The concrete slab was lifted slowly, revealing Davis's crushed right leg. Eleanor didn't flinch at the sight, immediately applying a tourniquet and administering medications to prevent the potentially fatal complications of crush syndrome. "We've got him," the team leader assured her. "Transport is waiting." Only then did Eleanor step back, allowing the rescue team to secure Davis for evacuation. As they carried him out, he reached for her hand. "Thank you," he whispered. "For staying." She squeezed his hand once, then let go, watching as he was carried to safety. Outside the bunker, the attack had been repelled. The perimeter was secured, the enemy fighters driven back into the mountains. Smoke rose from various points around the base, but the immediate danger had passed. Eleanor emerged from the damaged structure, dust-covered and exhausted, to find General Wilson waiting with Captain Matthews and a full medical team. "Hayes," Wilson said, his voice a mixture of relief and disbelief. "When they said you went into that bunker, I thought 5 wounded. All alive, all evacuated," she reported, professionally, cutting off his concern. "Davis will need immediate vascular surgery to save his right leg. Daniels requires thoracic assessment for potential subclavian artery damage. The others are stable but need monitoring for blast-related injuries." Matthews stepped forward, offering support as Eleanor's adrenaline began to fade, revealing the toll the ordeal had taken on her 62-year-old body. "You could have been killed," he said quietly. "So could they," she replied simply. As they walked back toward the medical compound, soldiers stopped what they were doing to watch her pass. Some saluted, others simply stared in awe. The woman, who had once been dismissed as too old, too traditional, too rule-bound, had just risked her life in a collapsing bunker to save men half a century her junior. By nightfall, the story had spread across not just Phobe Sentinel, but bases throughout Afghanistan. Eleanor Hayes, the legend who had saved 12 soldiers during a mortar attack, had now crawled through a drainage pipe into an active combat zone to save 5 more. Her age, once a source of mockery, had become irrelevant in the face of her courage and skill. In the quiet of the medical tent, as the base settled into uneasy recovery, Eleanor sat completing her reports. Her hands, steady through the worst of the crisis, now showed the slightest tremor, not from fear, but from the physical toll of what she had endured. General Wilson found her there, 2 cups of coffee in hand. He set one beside her without comment, then took the seat across from her desk. "The Secretary of Defense called," he said after a moment. "Apparently, your actions today made it all the way to Washington." Eleanor continued writing, not looking up. I'm sure they're concerned about the protocol violations. Actually, they're creating a new medal, the Hayes Commendation for Medical Valor. He sipped his coffee. First recipient's already been chosen. Now she did look up, her expression skeptical. I don't need medals, General. No, he agreed, but the next generation of combat medics needs heroes. Real ones, not the kind they create in training simulations. He set a folder on her desk, different from the one he had brought that morning, this one bearing the seal of the Joint Chiefs. What's this? She asked. Your new orders. They want you to develop a comprehensive combat medical training program. Not just for Afghanistan, for every combat theater where American forces are deployed. Eleanor stared at the folder but didn't open it. I'm needed here. You've already changed here, Hayes. Now they want you to change everywhere. He leaned forward. This is what you've fought for since they demoted you to consultant. The chance to rewrite the rules so no one else has to break them to save lives. As the night deepened outside, Eleanor finally opened the folder, reading through the detailed proposal. Everything she had advocated for years, adaptable protocols, practical training methods, recognition of field experience over theoretical knowledge was there, formalized into a program that bore her name. Why now? She asked finally. After all these years of being told I was outdated, obsolete? General Wilson's expression turned somber. Because when that bunker was collapsing and those men were dying, the outdated nurse was the only one who knew what to do. He stood. To leave, sometimes it takes a crisis to remind us what actually matters. After he left, Eleanor remained at her desk, the proposal open before her, the weight of possibility heavy in her hands. Through the open tent flap, she could see the medical compound where her trainees continued to treat the wounded from the day's attack. They moved with confidence now, with purpose, young men and women carrying forward the lessons she had spent a lifetime learning. Captain Matthews approached hesitantly, stopping at the entrance to her office space. Ma'am, the team wanted you to know, Davis is stable. They think they can save his leg. Eleanor nodded, a small smile softening her features. Thank you, Captain. He hesitated, then added, Cooper told us what you did in that bunker. How you stayed when everyone else would have left. His voice grew quieter. She said you covered Davis with your own body when the wall came down. Anyone would have done the same, Eleanor replied. Matthews shook his head. No, ma'am, they wouldn't have. That's what we've learned from you, not just the medicine, but the courage to use it when everything is falling apart. As he left, Eleanor turned back to the proposal, seeing beyond the words to the future they represented. She had entered this war as an outcast, laughed off the base by those who saw only her age. Now she would leave it as the architect of a new approach to battlefield medicine, her methods taught to generations of combat medics yet to come. Outside, the stars shone over Afghanistan's mountains with cold, distant beauty. Eleanor Hayes, the woman they had once dismissed, the legend they now followed, picked up her pen and signed her name to the future. The Pentagon's main corridor echoed with the measured click of Eleanor Hayes' sensible shoes as she walked toward the conference room. 6 months had passed since the attack on FOB Sentinel. 6 months since she'd crawled through a drainage pipe to save 5 trapped soldiers. 6 months since she'd been summoned back to Washington to reshape combat medical training across all military branches. At 62, Eleanor moved with the same quiet efficiency that had defined her decades of service. Her silver hair was still pulled back in its customary bun, her posture still military straight, despite never having officially served in uniform. The only concession to her new status was the security badge that hung around her neck, granting her access to levels of the military medical establishment that had once dismissed her methods as outdated. Junior officers stepped aside as she passed, some offering respectful nods, others watching with barely concealed curiosity. The legend of the professor had grown beyond Afghanistan, fueled by stories that spread from base to base, hospital to hospital, eventually reaching the sterile corridors of power where military doctrine was established. "Dr. Hayes," called a voice behind her. Eleanor turned to see Admiral Collins, the Surgeon General of the Navy, hurrying to catch up. Despite her lack of formal medical credentials, military leadership had taken to addressing her as "Doctor," a sign of respect for her practical expertise that transcended academic titles. "Admiral," she acknowledged with a small nod. "I thought the Joint Medical Command meeting wasn't until 10. "It's not about the meeting," Collins said, falling into step beside her. "It's about the training program at Camp Pendleton. The results came in this morning." He handed her a tablet with performance metrics displayed across the screen. 91% survival rate in the final practical assessment, the highest we've ever recorded. Eleanor glanced at the data, her expression revealing nothing. "It should be higher. The simulations don't account for communications breakdown or multiple system failures." Collins chuckled. 6 months in Washington hasn't softened your standards, I see. Standards don't need softening, Admiral. They need sharpening." They reached the conference room where representatives from every military branch waited. The space fell silent as Eleanor entered, not the awkward hush of discomfort, but the expectant quiet of attention. These men and women, many with decades of military medical experience themselves, now looked to the civilian consultant they had once ignored for guidance on how to save more lives in humanity's worst environments. At the head of the table stood General Wilson, now serving as the Joint Medical Commander after his promotion. Beside him stood a man Eleanor didn't recognize, tall, distinguished with the bearing of someone accustomed to authority. "Ms. Hayes," Wilson greeted her formally, though his eyes showed the familiar respect that had developed during their time in Afghanistan. "May I introduce Secretary Harrington, Department of Defense?" The secretary extended his hand. "Ms. Hayes, your reputation precedes you." "Most reputations do," Eleanor replied evenly, shaking his hand. "They're rarely accurate. In your case, I suspect they understate the reality." The secretary gestured toward the seat at Wilson's right, a position of honor that would once have been unthinkable for a civilian consultant. "Please, we've been waiting for you to begin." As Eleanor took her seat, she noted the materials placed before each attendee, thick binders bearing the title Hayes Combat Medical Protocol Implementation Strategy. 6 months of work, countless hours of documentation, practical assessments, and hard-fought bureaucratic battles had culminated in this moment. "Ladies and gentlemen," Secretary Harrington began, "we're here today to formally approve the most significant overhaul of military medical training in 30 years. The Hayes Protocol represents not just a new methodology, but a fundamental shift in how we prepare medical personnel for combat environments." He turned to Eleanor. "Ms. Hayes, would you outline the core principles for those who haven't been directly involved in the development process?" Eleanor stood, her voice clear and measured as she addressed the room. "The Hayes Protocol is built on 3 fundamental principles. First, adaptability over rigidity, training medics to understand not just what to do, but why they're doing it, so they can modify procedures when circumstances demand it. Second, practical competence over theoretical knowledge, ensuring every technique can be performed under stress, with limited resources, in hostile conditions. Third, psychological resilience, teaching medics how to maintain clarity and purpose when everything around them is chaos." She paused, looking around the room. "This isn't revolutionary. It's simply acknowledging what combat medics have always known, that the difference between life and death isn't found in manuals. It's found in the moment when training meets crisis, and a medical provider must decide how to save a life with whatever they have at hand." For the next hour, Eleanor led the assembly through the details of the program, the restructured training curriculum, the immersive simulations, the integration of veterans as instructors, the emphasis on improvisation and resource management. Throughout her presentation, questions were raised, concerns voiced, but none with the dismissive tone that had once greeted her ideas. Implementation begins next month at all major training facilities, she concluded. Full integration across all branches is projected for 18 months from today. By this time next year, every combat medic deployed to active theaters will be trained under these protocols. As she returned to her seat, Secretary Harrington rose again. Thank you, Ms. Hayes. Before we move to formal approval, I have an announcement. He nodded to an aide who distributed sealed envelopes to each person present. Please do not open these until instructed. Eleanor received her envelope with a sense of wariness. In her experience, surprises in Pentagon conference rooms were rarely positive. As you know, the secretary continued, the President has taken a personal interest in the Hayes Protocol, particularly after reviewing the data from Afghanistan. This morning, he signed Executive Order 14,392, establishing the Advanced Combat Medical Corps, an elite unit of medical personnel trained specifically for high-risk extractions and mass casualty events in hostile territories. Murmurs spread around the table as the implications became clear. This was more than approval of a training program. It was the creation of an entirely new military medical capability. You may now open your envelopes, the secretary instructed. Eleanor broke the seal on hers, unfolding a formal letter on White House stationery. As she read, her carefully maintained composure faltered for the first time since entering the Pentagon. This is a commission, she said, looking up at Secretary Harrington, Brigadier General Medical Corps. He nodded. The President felt that the Director of the Advanced Combat Medical Corps should have the appropriate rank to implement their vision without bureaucratic interference. A small smile crossed his face. Congratulations, General Hayes. The room erupted in applause, genuine, respectful, acknowledging what everyone present already knew, that Eleanor Hayes had earned this recognition not through political connections or academic credentials, but through decades of saving lives. When others had given up, for a moment, Eleanor sat motionless, the letter heavy in her hands. She had never sought rank, never pursued accolades. Her fight had always been for the wounded, for the young medics who needed better training, for the soldiers who deserved the best possible care when bullets were flying and blood was flowing. Mr. Secretary, she said finally, her voice cutting through the applause, I appreciate the honor, but I'm not a military officer. I've never served in uniform. An oversight. We're correcting today, Secretary Harrington replied. Your service record has been reconstructed from operational reports spanning 3 decades. Your time as a civilian consultant has been reclassified as active duty in special status. The commission is backdated accordingly. General Wilson leaned closer, speaking quietly so only Eleanor could hear. This isn't just about recognition, Hayes. It's about authority. As a general, no one can dismiss your methods or override your decisions. You'll have the power to implement changes. That would take years through conventional channels. Eleanor looked down at the commission again, seeing beyond the formal language to what it truly represented, not personal glory, but the ability to ensure that what happened at FOB Sentinel, what happened in Iraq, what happened in a dozen forgotten battles where medics had been forced to choose between following protocol and saving lives, would never happen again. I accept, she said simply, folding the letter and returning it to its envelope. The formal ceremony took place 3 days later in the Pentagon Central Courtyard. Eleanor stood in her new uniform, the general's star gleaming on each shoulder. As the Secretary of Defense administered the oath of office, behind her stood rows of medical personnel, doctors, nurses, medics, corpsmen, many of whom had trained under her in Afghanistan or at the pilot program since established across the country. Among them, Captain Matthews watched with undisguised pride as his former mentor placed her hand on the Bible and swore to support and defend the Constitution. Beside him stood Medic Cooper, now a commissioned officer herself, following the path Eleanor had illuminated during those harrowing minutes in the collapsed bunker. In the front row, a young soldier in a wheelchair observed the proceedings with keen interest. His uniform bore the name Davis, the man Eleanor had refused to abandon when the bunker was collapsing around them. His right leg, saved through the emergency procedures she had initiated under fire, was still healing, but the doctors had assured him he would walk again. As the ceremony concluded, Eleanor faced the assembled crowd. Protocol dictated a formal address, but she had never been one to follow protocol merely for its own sake. "I stand before you today not because of what I did," she began, her voice carrying across the courtyard without need of amplification, "but because of what countless medical personnel have done in the worst conditions imaginable. This commission honors their courage, their innovation, their refusal to surrender when textbooks offered no answers and protocols proved inadequate." She paused, her gaze moving across the faces before her, young and old, experienced and novice, all united by the sacred duty of preserving life amid destruction. "The advanced combat medical corps we build today will not be defined by rank or tradition, but by a single principle, that every wounded warrior deserves the best care humanly possible, no matter the circumstances. We will train not just for the wars we expect, but for the chaos we cannot predict. We will value adaptability over dogma, courage over caution, and above all, the determination to never ever leave someone behind." As applause erupted around her, Eleanor caught sight of a familiar face at the back of the crowd, General Wilson, nodding slightly, a gesture that carried the weight of their shared journey from the dust of Phobe Sentinel to the marble halls of the Pentagon. The weeks that followed passed in a blur of activity as Eleanor assembled her team for the Advanced Combat Medical Corps. She selected personnel not based on rank or credentials, but on demonstrated ability to perform under pressure. Combat-tested medics who had improvised solutions when supplies ran out, surgeons who had operated under artillery fire, nurses who had maintained order when evacuation seemed impossible. Her headquarters was established not in the Pentagon's comfortable offices, but at Fort Beaver's Medical Training Center, where she could directly oversee the practical implementation of her protocols. There, surrounded by simulation labs and training fields, Eleanor built what many would later call the most elite medical force in military history. 3 months into her tenure as commander, Eleanor stood observing a night training exercise. Below her position on an observation platform, 20 medical teams navigated a simulated battlefield, treating casualties with realistic injuries, while instructors triggered unexpected complications, equipment failures, environmental hazards, enemy fire that forced them to adapt continuously. "Impressive," said a voice beside her. Eleanor turned to find Admiral Collins watching the exercise with her. "They're performing procedures I wouldn't attempt in a fully equipped operating room, let alone in a mud pit under simulated gunfire." "They can do better," Eleanor replied, making notes on her tablet as one team struggled with a particularly challenging scenario. "Team 4 needs more practice with traumatic amputation protocols, and Team 7 is still too reliant on standard equipment." Collins smiled, always pushing for more. "Always," she agreed without apology. "That's why I'm here, actually." He handed her a classified folder. 3 days ago, a special operations team was compromised deep in territory I'm not officially authorized to name. 4 operators wounded, extraction impossible due to enemy presence. They've established a defensive position, but medical supplies are limited and the closest conventional forces are 6 hours out. Eleanor reviewed the contents quickly, her mind already calculating possibilities. Injuries, 2 with gunshot. Wounds, 1 with blast trauma, one with an unspecified illness that's rapidly deteriorating. Local temperature is dropping to near freezing at night. They've lost most of their medical supplies during the initial contact. She looked up from the folder. Why bring this to me? Special Operations has their own medical protocols for compromised missions. Because their survival probability under those protocols is estimated at less than 40%. Collins met her gaze directly. The Joint Chiefs want to know if your advanced combat medical corps could change those odds. For a moment, Eleanor was silent, weighing the implications. The CMC was still in formation, its capabilities untested beyond training scenarios. Deploying them to an active combat zone for an extraction, this complex would be unprecedented. Who's currently providing medical support for the compromised team? She asked. A combat medic, designated only as Sierra 3 in the briefing materials. 24 years old, 11 months in country. Eleanor nodded, a decision crystallizing. I'll need 6 medical personnel of my choosing. 2 modified transport helicopters, specialized equipment from our development lab, and clearance to operate under my authority without region-specific restrictions. Collins raised an eyebrow. You're going yourself. The medic on the ground needs direct support from someone who can guide them through procedures beyond standard training. That's me. General Hayes, Collins said carefully. You're 62 years old and the commander of a critical new military capability. The Pentagon won't approve your direct involvement in a high-risk extraction. Eleanor's expression hardened slightly. Then don't tell them until we're airborne. By the time they figure it out, we'll either have succeeded or failed. She held his gaze. You came to me because conventional approaches won't work. Don't ask for unconventional solutions if you're not willing to accept unconventional methods. 20 hours later, Eleanor sat in the rear compartment of a specially modified Black Hawk helicopter, reviewing medical files on a secure tablet. Around her, 5 members of her hand-picked team checked equipment and prepared for what would be the ACMC's first real-world mission. Captain Matthews sat across from her, now serving as her executive officer. Beside him, Lieutenant Cooper verified the contents of their specialized medical kits, designed specifically for the injuries described in the intelligence briefing. Final approach in 20 minutes, the pilot's voice announced over the intercom. LZ is hot. Prepare for immediate deployment. Eleanor set aside her tablet and addressed her team. The operators we're extracting have been maintaining position for nearly 30 hours. The medic on the ground has kept them alive through multiple treatment challenges, but their supplies are critically low and at least one patient is showing signs of sepsis. She moved to the center of the compartment where a terrain model displayed their landing zone, a narrow valley between steep mountains, offering minimal cover and multiple points from which enemy forces could engage. Our primary objective is stabilization and extraction of all wounded personnel. Our secondary objective is to provide the on-site medic with whatever support they need to maintain patient stability during transport. We will be on the ground for no more than 15 minutes. Every second beyond that increases risk exponentially. The team nodded, their expressions showing not fear but focused determination, exactly what Eleanor had selected them for. One final thing, she added, her voice softening slightly. The medic who's kept these operators alive for 30 hours with minimal supplies and no support has already performed heroically. Remember that when we land, we're not rescuing them, we're reinforcing them. As the helicopter descended toward the landing zone, Eleanor felt the familiar calm that had always come to her in crisis situations. Around her, her team made final preparations, checking tourniquets, verifying drug dosages, securing equipment for rapid deployment. The Black Hawk touched down with a jolt, rotors still spinning as the rear ramp lowered. Eleanor was first out, medical pack secured to her back, moving with the efficiency of someone half her age. Her team followed in practiced formation, creating a protective perimeter around her as they moved toward the camouflaged position where the Special Operations Team had established their defensive position. A figure emerged from the concealed entrance, young bearded, his uniform caked with dried blood and dirt. His eyes widened slightly at the sight of Eleanor's general stars, visible even in the dim light of dawn. "Sierra 3?" Eleanor asked. "Yes, ma'am," he replied, straightening despite obvious exhaustion. "General Hayes, Advanced Combat Medical Corps. We're here to help you complete your mission, medic." The young man blinked in momentary confusion. Then understanding dawned. "You're the professor." "From Afghanistan." Eleanor nodded once. "Show me your patients." Inside the makeshift shelter, 4 operators lay on improvised bedding, their conditions matching the severity described in the briefing. Sierra 3 had done remarkable work with limited resources, fashioning chest seals from plastic wrappers, creating traction splints from rifle components, maintaining 4-access using techniques that weren't taught in any standard course. Eleanor moved between the patients, assessing each with practiced efficiency. "Impressive work," she told Sierra 3 as she examined a chest wound that would have been fatal without his intervention. "Where did you learn this particular technique?" "From the Hayes Protocol Manual, ma'am," he replied. "Our unit got an advance copy. I've been studying it every night since deployment." A small smile touched Eleanor's lips. "Well, today you get the practical exam. Lieutenant Cooper, prepare for immediate stabilization and transport. Captain Matthews, establish a secure corridor to the extraction point. We move in 10 minutes. What followed was a precisely choreographed medical intervention that represented everything the Advanced Combat Medical Corps had been designed to achieve. Eleanor and her team, working in seamless coordination with Sierra 3, stabilized the 4 wounded operators using techniques that combined military precision with battlefield innovation. For the operator with developing sepsis, they implemented an advanced antibiotic delivery system developed in Eleanor's research lab. For the one with multiple gunshot wounds, they applied a new hemostatic foam that sealed internal bleeding without requiring surgical intervention. Throughout it all, Eleanor guided Sierra 3 through procedures well beyond his training level, teaching even as they fought to save lives. Exactly 14 minutes after landing, they were airborne again, all 4 patients secured for transport. Their conditions stabilized beyond what conventional medical protocols could have achieved. As the helicopters gained altitude, Eleanor moved through the cabin, checking each patient one final time before taking a seat beside Sierra 3, who sat staring at his blood-covered hands with the 1,000-yard gaze of someone coming down from prolonged combat stress. "Medic," she said quietly, drawing his attention. "What's your name? Your real name?" "Rodriguez, ma'am. Michael Rodriguez." "Well, Rodriguez, I've been doing this for 40 years through 3 wars and countless operations. What you managed to do, keeping these men alive for 30 hours with minimal supplies and no support, ranks among the most impressive feats of combat medicine I've ever witnessed." The young man shook his head slightly. "I was just following the manual, ma'am." "Your manual?" "No," Eleanor corrected gently. "The manual provides guidance. What you did took courage, innovation, and the refusal to give up when everything was working against you. Those things can't be taught. They can only be inspired." She reached into her pocket and pulled out a small object, a combat medic badge from an earlier era, worn smooth from decades of handling. "This was given to me in Iraq by a medic who saved my life when our convoy was hit by an IED. He told me it had been passed down from another medic in Vietnam, who received it from a Korean War veteran." She placed it in Rodriguez's palm. "Now, it's yours. Someday you'll know when to pass it on." The young medic stared at the badge, its significance slowly dawning on him. "Ma'am, I can't accept this. You're a general, and I'm just a combat medic who didn't leave his team behind," Eleanor finished for him. Rank doesn't determine legacy, Rodriguez. Actions do. As the helicopter continued its journey back to base, Eleanor observed her team working in quiet coordination, each member focused on their patients with the same determination she had instilled in them. Matthews, once an arrogant young doctor who had mocked her age, now moved with the humble confidence of someone who understood that knowledge came in many forms. Cooper, who had followed Eleanor into a collapsing bunker in Afghanistan, now led her own medical team with the same courage and precision. And Rodriguez, the young medic who had kept 4 men alive against impossible odds, watched it all with growing understanding that he was part of something larger than himself, a tradition of battlefield healers who fought death with nothing but skill, determination, and the refusal to surrender. In that moment, flying over hostile territory with 4 lives secured and a new generation of combat medics carrying forward her legacy, Eleanor Hayes finally allowed herself to acknowledge what others had been saying for months, that the woman who had once been laughed off a military base for daring to suggest she could still save lives had transformed, not just herself, but the entire approach to battlefield medicine. The old woman hadn't just saved 12 soldiers in Afghanistan. She had ensured that countless more would be saved in conflicts yet to come, by medics yet to be trained, using methods that valued life above protocol and courage above convention. As the first light of dawn broke across the horizon, General Eleanor Hayes looked toward the future with quiet satisfaction, knowing that her greatest achievement wasn't the star on her shoulder or the protocols that bore her name. It was the lives that would be saved long after she was gone, by those who carried forward her simple, powerful legacy. Never leave anyone behind. 5 years had passed since Eleanor Hayes had transformed from a dismissed civilian consultant to brigadier, general and architect of the Advanced Combat Medical Corps. What began as an experimental unit had evolved into the gold standard for battlefield medicine across all branches of the military. The Hayes Protocol was now taught in every medical school with a military affiliation, and combat zones from the Middle East to Southeast Asia had reported unprecedented survival rates as a result. On this crisp autumn morning, Eleanor stood before the graduating class of the ACMC's elite training program at Fort Beaver. At 67, she remained as formidable as ever, her silver hair still pulled back in its characteristic bun, her uniform immaculate, her posture military straight. Only the deepened lines around her eyes betrayed the additional years of service she had given to her country. The certificates you receive today represent more than completion of a training program, she told the assembled graduates, her voice carrying across the parade ground without need of amplification. They represent your commitment to a sacred principle, that no wounded warrior will be abandoned, regardless of conditions, regardless of odds, regardless of cost. The graduating class, 100 medical professionals selected from thousands of applicants, stood at attention, their faces reflecting the gravity of the responsibility they were accepting. Unlike traditional military formations, this one was notable for its diversity, not just in ethnicity and gender, but in age. The ACMC, under Eleanor's leadership, had rejected the military's traditional emphasis on youth, instead selecting candidates based on demonstrated aptitude, regardless of when in their career that aptitude emerged. Some of you, Eleanor continued, came to us directly from medical school, your minds uncluttered by convention, your hands eager to learn. Others came with decades of experience, your skills refined by years of practice in civilian hospitals or military installations. Each of you brings something essential to this corps. Her gaze moved across the formation, recognizing faces she had personally observed during the grueling selection process. In the field, when bullets are flying and lives hang in the balance, what will matter is not your age, your rank, or your credentials. What will matter is your judgment, your courage, and your absolute refusal to accept defeat when a life can be saved. As she spoke these words, Eleanor couldn't help but remember her own journey, from the respected combat nurse, whose career was derailed by her refusal to follow protocols that would have meant certain death for her patients, to the logistics lady relegated to clipboard duties, to the legend who had crawled through a drainage pipe to save trapped soldiers when no one else would risk it. 5 years ago, the conventional wisdom held that combat medicine was a young person's game, that physical stamina mattered more than experience, that following protocol mattered more than understanding why protocols exist. Today, we know. Better, today, we understand that the best medical teams combine the energy of youth with the wisdom of experience, the discipline of training with the creativity of improvisation. At the edge of the parade ground, Eleanor noticed a group of distinguished visitors observing the ceremony. Secretary of Defense Harrington stood with several members of the Joint Chiefs. Beside them, using a cane but standing proudly, was James Davis, the soldier Eleanor had refused to abandon in the collapsing bunker. Now a civilian trauma counselor working with wounded veterans, he had become a regular visitor to the ACMC training facility, sharing his perspective as both a survivor and a healer. Most surprising, however, was the figure standing slightly apart from the others, Captain Ryan Matthews, now a full colonel and the director of combat medical training for the Army, once the embodiment of the arrogance that had dismissed Eleanor. As too old and too traditional, he had become one of her most dedicated supporters, implementing her methods throughout the conventional forces with evangelical zeal. Today, you join a legacy that stretches back through the history of warfare, Eleanor told the graduates, concluding her address. From the battlefield surgeons of the Revolutionary War to the combat medics of World War II, from the MASH units of Korea to the dust-covered corpsmen of Vietnam and beyond, you stand in a line of healers who have faced humanity's darkest moments with courage, skill, and compassion. She paused, allowing her next words to carry their full weight. Remember this always: when others run from danger, you will run toward it. When others see hopelessness, you will see possibility. When others accept death as inevitable, you will fight for life with every tool at your disposal, whether that tool is a scalpel, a pressure bandage, or simply your refusal to give up when all seems lost. With these words, Eleanor concluded the formal graduation ceremony. As the newly commissioned members of the ACMC dispersed to celebrate with family and colleagues, she made her way toward the group of dignitaries waiting to speak with her. Another impressive class, General Hayes, Secretary Harrington said, shaking her hand. The President sends his regards and his continued support for the program. Please convey my thanks, Eleanor replied diplomatically, though both knew her relationship with political leadership had always been professionally distant. Her focus remained on the medical corps she had built, not on the politics that surrounded it. Colonel Matthews approached next, his once cocky demeanor long since replaced by genuine respect. General, I wanted to let you know that the Army has formally adopted the full Hayes Protocol for all combat medical training. The last holdouts in Special Operations Command signed off yesterday. Eleanor allowed herself a small smile. It only took 5 years and several hundred saved lives to convince them. Some lessons take longer to learn than others, Matthews acknowledged, a hint of his own journey evident in his tone. James Davis was the last to approach, moving slowly but purposefully with his cane, though his right leg had been saved. Had never fully recovered from the crush injuries sustained during the attack on Phobe Sentinel. Ms. Hayes, he said, deliberately using her civilian title rather than her military rank, a personal connection that transcended formal hierarchy. I hope you don't mind me crashing your graduation ceremony. You're always welcome here. Davis, she replied warmly. These new graduates could learn a lot from your perspective. He nodded, then lowered his voice so only she could hear. Actually, I came because I heard a rumor. They say you're planning to retire. Eleanor's expression revealed nothing, but she didn't deny it. Nothing lasts forever, Davis, not even my stubbornness. Before their conversation could continue, an aide approached with urgent news, a situation requiring Eleanor's immediate attention in the command center. Excusing herself from the gathering, she made her way across the training facility to the modern building that housed the ACMC's operational headquarters. Inside, a team of officers monitored screens displaying real-time data from combat zones around the world. At the center of the room, a holographic display showed a detailed terrain map of a mountainous region that Eleanor immediately recognized as the Afghanistan-Pakistan border. General Hayes, her executive officer, greeted her. "We have a situation developing at Forward Operating Base Echo. Massive earthquake, 7.8 magnitude, with severe damage to military and civilian infrastructure. The base hospital has partially collapsed, and there are reports of significant casualties, both on base and in surrounding villages." Eleanor studied the display, absorbing the information with practiced efficiency. Current medical resources in the area? Limited. The collapse damaged most of their supplies, and nearby hospitals are overwhelmed with civilian casualties. Weather conditions are deteriorating, making conventional medevac operations problematic. How many CMC personnel are currently in that region? 3 teams, ma'am. Team Bravo is closest, approximately 60 miles south of the affected area. Eleanor nodded, decision already forming. Alert Team Bravo for immediate deployment to FOB Echo. Have them prepare for mass casualty management in compromised infrastructure. Conditions, and ready my transport. I'm going on site. Her executive officer hesitated. "General, with respect, the Pentagon will never approve your direct involvement in a disaster response mission. The risk assessment alone would." "I'm not asking for approval, Colonel," Eleanor interrupted calmly. "I'm informing you of my decision. This is precisely the scenario the CMC was created for, and I intend to assess our operational effectiveness firsthand." Before further objections could be raised, she turned to her communications officer. "Contact Major Rodriguez. Tell him to meet me at the airfield in 30 minutes. As her staff scrambled to implement her orders, Eleanor returned to her office to collect a few items she would need for the mission. The space reflected her practical nature: minimal decoration, functional furniture, walls lined with medical text and operational manuals. The only personal touches were a display case containing the combat medic badge she had worn before passing it to Rodriguez, and a framed photograph of the original 12 soldiers she had saved during the mortar attack on Phobe Sentinel. As she packed a small kit of essential items, there was a knock at her door. Colonel Matthews stood in the doorway, his expression concerned. "You're going to Afghanistan," he said. It wasn't a question. "I am. The Secretary of Defense just received notification." "He's not pleased." Eleanor continued packing. "The Secretary's approval is not required for a CMC operational deployments. That autonomy was part of our founding charter." "Hayes," Matthews said, dropping military formality, "you're 67 years old. You're the commander of the entire ACMC. You don't need to be on the ground for this." She paused, looking up at him. "Do you remember what you said to me at Phobe Sentinel after I treated those 12 soldiers during the mortar attack? You said I was too old, that my methods were outdated, that I should step aside for younger doctors." Matthews winced at the memory. "I was wrong. Yes, you were. But you weren't alone in that thinking." She closed her bag with a decisive snap. "For 5 years, I've built this course on the principle that experience matters, that age is not a disqualification, that wisdom earned through decades of service has value that can't be replicated by youth alone." She moved toward the door, stopping beside him. "If I stay behind now because I'm too old for field operations, I undermine everything I've fought for. I become a hypocrite, sending others to do what I claim I'm too old to do myself." Matthews held her gaze for a long, moment, then nodded slowly. "At least take me with you. The army can spare me for a few days." "No," Eleanor replied firmly. "You're needed here, implementing the protocols throughout conventional forces. That work doesn't stop because of an earthquake." As she walked out of her office, possibly for the last time, Eleanor felt the familiar calm that had always preceded her most challenging missions. Age had not diminished this clarity. If anything, it had enhanced it, stripping away uncertainties and leaving only the essential truth that had guided her entire career. When lives hang in the balance, nothing matters except the willingness to act. 90 minutes later, Eleanor sat in the cabin of a C-17 transport aircraft, reviewing geological data on the affected region as they crossed the Atlantic. Beside her, Major Michael Rodriguez, once the young medic who had kept 4 special operators alive against impossible odds, now a senior field commander in the ACMC, studied medical supply inventories for the region. Team Bravo reports they're already airborne. ETA to Phobe Echo in 3 hours, he informed her. Initial casualty estimates are climbing. At least 40 military personnel injured in the collapse. Unknown number of civilians in surrounding areas. Eleanor nodded, scrolling through satellite imagery of the damaged base. The hospital took the worst of it. Southern wall completely collapsed, eastern wing compromised. They'll have moved the wounded to the mess hall based on standard contingency plans, but that facility isn't designed for medical operations. "Just like old times," Rodriguez observed with a grim smile. "Making do with whatever's available." "Some things never change," Eleanor agreed. War, earthquakes, floods. The packaging varies, but the challenge remains the same. Save lives with whatever you have at hand. As their aircraft continued its journey toward Afghanistan, Eleanor found herself reflecting on the symmetry of the situation. Her career had been defined by a willingness to enter dangerous situations when others stepped back. From her early days as a combat nurse in Desert Storm to the mortar attack that had revealed her skills to FOB Sentinel, from the collapsing bunker where she had refused to abandon a trapped soldier to the special operations extraction that had established the ACMC's reputation. Now possibly her final mission would take her back to the same region where her legend had been born, facing the same fundamental challenge: how to save lives when conventional methods failed. 20 hours later, the C-17 touched down at a makeshift airstrip near the earthquake zone. The damage was immediately visible: fissures in the runway, collapsed structures in the distance, dust still hanging in the air from aftershocks. A military convoy waited to transport them to FOB Echo, where Team Bravo had already established emergency medical operations. As their vehicle navigated the broken landscape, Eleanor observed the devastation with a professional eye. Landslides had blocked major roads, bridges had collapsed, and entire villages appeared to have been swallowed by the earth itself. The scale of the disaster exceeded even the preliminary reports. "Reminds me of Haiti," Rodriguez said quietly. "Same level of infrastructure damage, same challenges for medical response." Eleanor nodded. "The difference is that we're better prepared now." The CMC was built for exactly this scenario: multiple casualty types, compromised facilities, limited conventional support. They arrived at Phobe Echo as dusk was falling, the damaged base illuminated by emergency generators and vehicle headlights. The scene was organized chaos, military personnel working alongside local civilians to clear debris, establish treatment areas, and coordinate rescue efforts for those still trapped in collapsed structures. Team Bravo had transformed the base's intact mess hall into a functional field hospital, implementing CMC protocols with impressive efficiency. Patients were categorized not just by injury severity, but by treatment complexity and resource requirements. A system Eleanor had developed specifically for mass casualty events in resource-constrained environments. The team leader, Major Sarah Cooper, once the young medic who had followed Eleanor into a collapsing bunker, met them at the entrance. "General Hayes," she greeted them with evident relief. "We didn't expect you personally." "Status report," Eleanor replied, already moving through the improvised hospital, assessing patients and operations with practiced efficiency. 62 military casualties processed so far, 47 stable, 15 critical. We've also taken in 38 local civilians with complex injuries, beyond the capacity of regional facilities. Cooper fell into step beside her. Primary challenges are orthopedic trauma, crush injuries, and increasing numbers of respiratory complications from dust inhalation. Eleanor nodded, noting the organized flow of patients, the efficient use of limited space, the evidence of CMC protocols being implemented exactly as designed. "You've done well, Major." "We're implementing your playbook, ma'am," Cooper replied. Simply. For the next several hours, Eleanor worked alongside the medical teams, treating the most complex cases, guiding less experienced personnel through difficult procedures, and continuously refining the operational flow as new challenges emerged. Despite her age, she moved with the energy and focus that had always characterized her work in crisis situations. As midnight approached, she found herself treating a young Afghan girl with a crushed pelvis, an injury that would have been fatal without immediate intervention. The girl's father watched in silent awe as Eleanor performed a procedure that stabilized the shattered bones using materials never intended for such a purpose. A splint crafted from tent poles, a traction system improvised from parachute cord. "Will she walk again?" he asked through an interpreter when the procedure was complete. "Yes," Eleanor assured him without hesitation. "Children heal remarkably well, especially with proper care." She turned to a nearby medic. "Ensure she's on the priority list for evacuation to the surgical hospital in Kabul once air transport resumes." As she moved to the next patient, Rodriguez approached with updated information. "Aftershocks continuing, ma'am. Engineers report. The base infrastructure is increasingly unstable. Command recommends full evacuation within 24 hours. Eleanor considered this information while examining a soldier with severe crush injuries to his chest. Current transport capacity? Limited. Weather's deteriorating, and most aircraft are prioritizing critical cases to regional hospitals. We're looking at 48 hours minimum to evacuate all patients at current rates. Unacceptable, Eleanor stated flatly. We need alternatives. Before Rodriguez could respond, a violent aftershock rocked the base, more powerful than any that had come before. Lights flickered, equipment crashed to the floor, and dust rained from the ceiling of the mess hall. Medical staff moved instinctively to protect their patients, covering them with their bodies as debris fell around them. When the shaking stopped, new alarms sounded across the base. Cooper rushed to Eleanor's side, face pale with urgency. "Ma'am, the eastern wall is failing. Structural engineers say we have minutes, maybe less, before complete collapse." Eleanor assessed the situation in seconds. Begin immediate evacuation. Priority to critical cases, then ambulatory. Rodriguez, coordinate with base security for alternative shelter locations. Cooper, I need a team to help relocate life support equipment. As the evacuation began, organized despite the chaos, Eleanor moved among the patients, ensuring each was prepared for transport. She had just stabilized a ventilator for a Marine with pulmonary contusions when another aftershock hit, shorter but more violent than the last. This time, the consequences were immediate and catastrophic. With a groaning sound that seemed to rise from the earth itself, the eastern wall of the mess hall began to collapse inward, sending tons of concrete and steel toward the treatment area where the most critical patients were located. Without hesitation, Eleanor lunged toward the nearest patient, a young soldier strapped to a backboard with spinal injuries. She covered his body with her own as the wall gave way, feeling rather than seeing the massive section of ceiling that followed. The impact came with crushing force, driving her to the ground beside the patient she had sought to protect. Pain exploded across her back and legs, then faded to a strange, distant numbness. Dust filled her lungs, darkness closed around her, and for a moment, she thought perhaps this was the end, a fitting conclusion to a life spent shielding others from harm. Then voices penetrated the darkness, familiar voices calling her name. With increasing urgency, hands began clearing debris, careful, practiced movements that spoke of medical training. "General Hayes, can you hear me?" It was Rodriguez, his voice tight with controlled panic. "The patient," Eleanor managed to say, her voice barely audible through the dust. "Check the patient first." "He's secure," came Cooper's voice from nearby. "You took the impact that would have killed him. Now lie still while we assess your injuries." Eleanor felt gentle, professional hands moving across her body, checking for fractures, lacerations, signs of internal bleeding. The numbness was fading now, replaced by waves of pain that spoke of significant trauma. "Status," she demanded, falling back on military directness. Rodriguez hesitated before answering. "Spinal compression injury, probable pelvic fracture, extensive crush trauma to lower extremities. We need to get you out of here now, ma'am." Eleanor processed this information with clinical detachment, understanding immediately what it meant. "The evacuation?" "Continuing," Cooper assured her. "We've secured alternative facilities in the intact barracks. All critical patients transferred successfully." "Except one," Eleanor observed grimly. "We're preparing you for transport now." Rodriguez continued, ignoring her implication. "Priority medevac to Landstuhl Regional Medical Center is being arranged." As they carefully moved her onto a specialized transport board, Eleanor remained focused on the operational situation despite her injuries. The remaining patients? "All stable, all secure," Cooper reported. "Your protocols worked exactly as designed. Even with the secondary collapse, we maintained treatment continuity for every patient." A small smile touched Eleanor's lips despite the pain. "The system works without me. That's what matters." They carried her from the damaged building into the open air, where a medical evacuation helicopter waited on an improvised landing zone. Around them, the CMC team continued its work, treating patients, coordinating resources, implementing the protocols Eleanor had developed with the same precision and dedication she had instilled in them. As they secured her in the helicopter, Rodriguez leaned close, his expression intense. "You're going to be all right, ma'am. The best trauma surgeons in Europe are already being notified." Eleanor reached up with surprising strength, grasping his arm. "Listen to me, Michael. Whether the first survive these injuries or not is secondary. What matters is that you continue the work. The CMC must remain true to its founding principle, that experience trumps convention, that courage trumps caution, that saving lives trumps following rules." He nodded, emotion breaking through his professional demeanor. "I will, ma'am. We all will. Your legacy is secure." As the helicopter lifted off, carrying her away from the earthquake zone and the core she had built, Eleanor Hayes looked down at the base where medical teams continued to work with undiminished dedication. Despite her absence, in that moment, she understood that she had achieved something far more significant than personal acclaim or military recognition. She had changed the system from within, transforming the military's approach to combat medicine from one bound by rigid protocols to one guided by experience and adaptability. She had proven that age was not a barrier to effectiveness, that wisdom earned through decades of service had value that couldn't be measured in physical stamina alone. Most importantly, she had built something that would outlast her, a corps of medical professionals who carried her principles not just in manuals and protocols, but in their hearts and minds, in the way they approached every challenge, every crisis, every wounded warrior entrusted to their care. 3 months later, Eleanor Hayes sat in a wheelchair on the porch of a modest house overlooking the Chesapeake Bay. Her injuries had been severe: multiple spinal fractures, a shattered pelvis, extensive damage to her right leg that had required partial amputation. The doctors had been amazed she survived it all, attributing her recovery to the same stubborn determination that had defined her entire career. She would never walk unaided again, never return to active duty, never perform the hands-on medical procedures that had once been second nature. Yet as she watched the sun setting over the water, Eleanor felt not loss but completion. The satisfaction of knowing her work had reached its logical conclusion. A car approached along the private drive, and Eleanor recognized the military vehicle immediately. As it parked, 3 figures emerged: Secretary Harrington, General Wilson, and Major Rodriguez, all in formal dress uniforms. "General Hayes," the secretary greeted her as they approached the porch. "You're looking well." "A polite fiction, Mr. Secretary," Eleanor replied with a small smile, "but I appreciate the sentiment." They settled into the chairs arranged on the porch, and for a moment, no one spoke. Finally, Wilson broke the silence. "The President has signed the order," he said. "The Hayes Combat Medical Training Center will be established at Fort Sam Houston, with construction beginning next month. All future combat medics, regardless of branch, will train under your protocols." Eleanor nodded, accepting this news with quiet satisfaction. "And the age restrictions for combat medical personnel?" "Eliminated," Rodriguez confirmed. "Experience and demonstrated ability now take precedence over chronological age across all services. The policy change cites your career as definitive evidence that traditional age limitations were counterproductive." "Then our work is complete," Eleanor said simply. Secretary Harrington cleared his throat. "There's one more thing, General Hayes." He produced an official document bearing the presidential seal. "The President has authorized me to inform you that you will receive the Medal of Honor for your actions during the Afghanistan earthquake response. The ceremony will take place next month at the White House, if your health permits." Eleanor accepted the document with steady hands, though her expression remained unchanged. "The Medal of Honor is typically awarded for battlefield valor, Mr. Secretary. I was simply doing my job." "With respect, ma'am," Rodriguez interjected, "shielding a wounded soldier with your own body during a structural collapse, at the cost of your mobility and nearly your life, meets every criterion for valor. Above and beyond the call of duty." The President agrees, as does every member of the Joint Chiefs. As the men departed, leaving Eleanor alone with the official notification and her thoughts, she wheeled herself to the edge of the porch where she could see the full expanse of the bay. The sun had nearly disappeared now, painting the water in shades of gold and crimson that reminded her of distant deserts where her legend had been born. In her long career, Eleanor Hayes had been many things: a combat nurse dismissed as too traditional, a logistics coordinator laughed off the base for suggesting she could still save lives, a civilian consultant who had crawled through a drainage pipe to rescue trapped soldiers, a general who had transformed military medicine from the inside out. Now, in the quiet of retirement, she had become something else entirely, a symbol of what could be accomplished when experience was valued over convention, when courage overcame caution, when saving lives took precedence over following rules. The old woman who had been laughed off the base hadn't just saved 12 soldiers in Afghanistan. She had saved thousands more who would never know her name through the protocol she had established, the cores she had built, and the example she had set for every medical professional who would follow in her footsteps. As darkness fell over the Chesapeake, Eleanor Hayes smiled, knowing that somewhere in the world, a wounded warrior was being saved by a medic trained in her methods, guided by her principles, inspired by her legacy. And in that knowledge, she found peace. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.